United, we're doing a campaign against UNC Medical School right now. They want to instill anti-racism in their entire medical school training, including getting rid of MCATs, holistic admissions, teaching doctors intersectionality. These are the top math and science students in the entire country, the top doctors in the entire country, and they're being fed anti-racism, not how to be a good doctor, not how to be a good engineer.
So you wrote about all of this in an op-ed in the Daily Mail. You said, quote, "The hate-filled far left are punishing thousands of hardworking students because they are the, quote, wrong race. Yes, progressives really are the true racists that they claim. It's different than equality. Equality gives everybody a level playing field and an opportunity to excel. Equity stops the highest performing people from excelling in order to make it look like the lower performing people are doing better than they are. And yet this is what's being pushed on America in terms of making everybody feel good. It's been likened to giving everyone a participation trophy, as opposed to the team that actually wins the championship being the only one to get a trophy.
Yeah, and I want to be clear where this is from. This is from the accreditation agencies. This is from, the Fairfax County School Board and the medical school accreditation agencies. They have 89 ways that people have to be DEI compliant today, including inviting these speakers like Nicole Hannah-Jones, practicing affirmative action in admissions. The American Association for Medical Professionals has the same DEI program that you can read about at colorusunited.campaign. But Fairfax County and the education and the healthcare lobby are conspiring together to create this kind of new racket that is being promulgated across American schools and medical schools across the entire nation.
So Bill McGurn wrote about all of this in a Wall Street Journal op-ed in which he said, "What makes Asian American achievement so resented by our equity warriors is that it exposes as false the narrative about an irredeemably racist America where minorities can't succeed." What do you think of that?
Exactly. They're the inconvenient minority. Think about a racist country, right? Why would a racist country let a minority group, Asian Americans, get the highest education levels in the entire nation, the highest incomes out of all of the racial groups in our country? Why would a racist country do that? And the answer is it's because we're not a racist country. Autocracy, and Thomas Jefferson shows this. Thomas Jefferson, the nation's #1 math and science high school across the entire nation, is 70% Asian. It's so Asian that the woke progressives feel that it's too Asian, and they want to admit more white kids now. How ironic is that? Woke progressives standing up for white kids. That should be the new mantra of the progressive left.
Katie Hsu, it's great to talk to you this Friday afternoon. This is a situation clearly that's got the attention of the nation because it's now not just happening in one place. It's beginning to happen all across the country. Thanks for being with us. Appreciate it. Sandra, and then there's the long-term effects of all of this as well, that if you keep the highest performing students from performing, what is that going to do to American competitiveness down the road when countries like China are doing everything they can to produce the highest achievers in the world, and then they have the backup to help them on their way to global domination of the economy? And that debate.
Okay, guys, good evening. So we're going to have another discussion about DEI and healthcare. Well, really, it's about DEI in every single institution. So the show that we did last week was so popular that we're for the wrong reason, right? Hopefully, yeah, we don't want to be talking about this, right? But so let me tell you what's going on here. We've exposed over the last 2 years CRT in all of our schools, right? We've also exposed social emotional learning. So social emotional learning really is DEI, and here's how it works. It's the surveys that kids take that put kids in buckets, right, of intersectionality, different identities, different beliefs, etc. And then it's the curriculum that molds kids into either non-binary, gay, trans, whatever, Christians, non-Christians, any category you can imagine. And it's backed by lessons plans that comes from the state and is bolstered by local curriculum. So we've exposed that in schools over the last 2.5 years. Now we're also exposing, because it's the same system, Nancy, you did a story, or Epic Times did a story on your discovery of UNC Pediatrics proudly putting out this garbage of the gingerbread person stuff. What was that? 2 years ago now?
Yeah, last year, I believe, a year and a half ago, about, yeah.
Right.
Yes.
And we exposed that in schools. So we were talking about that being in kindergarten classes, and all of a sudden, lo and behold, it is proudly displayed on the pediatrics page until Nancy got a hold of their ass. And then all of a sudden, poof, it was gone. But that is just an example of where this stuff is promoted inside of the medical world. Now we're talking about DEI. It's called, we explained it last week, but diversity, equity, and inclusion. DEI in the actual training of medical residents in North Carolina. It's happening at ECU, it's happening at UNC. Tell us about that, Nancy.
Yeah, it's incredibly concerning. I want to sound the alarm. People need to be very upset about this. Granted, this is an issue close to my heart, as I trained in general surgery between 2003 and 2010 at UNC in their general surgery residency at Chapel Hill, which at the time was excellent. I had amazing attendings. There were amazing doctors. You wanted a UNC surgeon to be your surgeon. Was very proud at the time of having trained there. And this is why I have this issue is very close to my heart, and I sometimes get a little emotional about it. But what's been happening, just like with our schools, with medicine the past couple of years, especially at UNC Health, should scare everyone, because it's going to affect you and your future visits with the doctors that are currently training at UNC. And it's starting to come to a head, and we know from current events that recently the UNC Board of Governors did the right thing in passing a policy to prevent compelled political speech. And you can basically think of DEI as political speech. It's political propaganda that leans in a specific leftist direction that essentially trains its ideologues in becoming activists for various social justice causes like climate change, immigration rights, all of these leftist issues that don't necessarily concern elementary school kids, nor your surgeon at the moment. They have enough to learn with medical biology and genetics and anatomy and all of that to begin with. Anyway, now, just like with the schools, DEI has invaded the practice of medicine. UNC is ground zero. And unfortunately, even though the Board of Governors did the right thing in banning this compelled political ideology, compelled DEI statements on resumes and all of that, it's much more ingrained than that. And I am not convinced that policy is going to stop it from continuing its march through the medical institution. And we have some very grave information that was recently uncovered by a journalist formerly from the Andrew Martin Center, which confirms these concerns, that goes all the way to the top of UNC Health.
Okay. So we're talking about, first of all, getting into medical school. So here's how medical school works. You obviously graduate from high school, you do an undergrad. Typically, you'll see an undergrad in biology. You'll see that's generally what it is. Some schools have pre-med, and then you will do something called matching. Here's what matching means. It means that you will select typically 5 medical schools that you want to go into. You will interview with them, and you will be judged on how, obviously, how well your MCATs are, which is an entrance exam for medical school, and then how well you would be suited for that program, and every program is different. Now, what a lot of schools are doing is this, eliminating MCATs altogether, okay? And also, for those match interviews, they're looking for something else. Maybe it's a lesbian they're looking to fill or something like that. But let me tell you what happens. See, the great equalizer are ACTs, SATs, MCATs, LSATs, and here's why. If there's no litmus test for getting into schools, then that means the wealthy can buy their way in. That's really what it means. I mean, a middle-class family can send their kid to, it used to be the American dream. You get a great SAT score out of your kid, and they are accepted to a college or maybe even get a scholarship. Now that's being erased. So the highest bidder will get to come in. I mean, you know, when I was going to school up north, we saw this because a lot of the Saudis could buy their way in. Obviously, I mean, you want to talk about out-of-state tuition. Well, I went to a private college, but the point is they can triple the amount or even quadruple and maybe even put in $100K in the pocket of an administrator to get their kids in. So it doesn't actually level the playing field. What it actually does is it creates a society where some are educated and some are not. So back to the medical school process, Nancy, it's affecting the selection of folks that can get into medical school. That's not even counting being a surgeon. A surgeon is after medical school, which you are a general surgeon. That is another matching process, right?
Yes.
What are we seeing for eliminating merit in that process?
Well, it's very scary because you can go to the website, and this is part of what I wrote about for the American Thinker in the past month. You can go to the UNC website and you can find through its diversity program that each individual department, like radiology, like surgery, has its own action plan. Part of the surgery action plan is a holistic approach to accepting applicants, which means de-emphasizing test scores, which is the one true objective measure. And already I can tell you that test scores weren't the only thing, you know, they looked at for applicants. They already looked at the whole package, the personality, the way to interact with patients. Obviously, you can have someone who gets super test scores, but in practical experience can't really interact or turns off patients. And that's, you know, you have to balance all those elements. But the total de-emphasis of test scores is a problem because then it makes the application process that much more subjective, and it's open to the corruption that Sloan, for example, talked about, where maybe legacies or huge donors buy their way into these programs, people who wouldn't actually be there through a merit process. And in surgery, just like in flying airplanes or building bridges, that is the last thing you want to have happen.
Yeah. So that's the entrance into these training places. Now, you mentioned something about prioritizing this woke nonsense. Woke nonsense is, I mean, it's socialist Marxism at its core. It's equal outcomes. It's hamstringing one group while helping another perceived group that's been oppressed. And we don't even have to tell you the terror of going to a pediatrician and having that happen, right? Just right. Yeah, I mean, that's scary as hell. I take my kid to go to a sports physical, and just because my skin color happens to be white or his is white, they're going to, God forbid, do something that would harm him.
Right. I mean, there's several ways that this could directly impact the individual North Carolina citizen in taking their children or their family members or themselves to a UNC trained physician or office. Now that the emphasis by people who don't have MDs, by the way, in the leadership of UNC Health.
Can you stop right there? So you're telling me that the people that are putting this into the program there in the medical school, they're not actually doctors.
They're not medical doctors, correct? Some of them are, but the main driver, the main person behind it, there is a dean of the School of Medicine DEI program, a specific person whose whole job is DEI at the School of Medicine, Diversity, Equity, Inclusion at the School of Medicine. His name, I believe, is E. Nathan Thomas. He is a PhD in something that has to do with ecology and something or other. I don't know. It's nothing to do with medicine. And he has been quoted, and I quoted this in my American Thinker article, is saying DEI needs to be infused into the School of Medicine at UNC and all institutions, or something to that effect. That would be the equivalent of being paid, if I were being paid, say, 6 figures to go in and say, I am going to infuse republicanism into all aspects of the School of Medicine, or I'm going to infuse libertarianism into all aspects. It's basically saying you're going to infuse a political ideology cultural ideology,
religious, actually,
religious ideology,
it's really a religion.
Yes, into all aspects of medicine, which is completely unethical and completely antithetical to any training that I did, in which the doctor needs to be objective, be open to people of all different ideologies, all different races, sexes, etc. And now with Mr. Thomas, PhD, he is going to turn the School of Medicine and its affiliate institutions, the departments of surgery, departments of medicine, department of peds, into his own personal political ideological practice. And what is so important, that was just released yesterday by the same journalist from before with the medicine task force, is that they are hiding it now. He found emails through a FOIA request written by Thomas that directly say that he wanted to keep the social justice task force for the Allied Health Sciences Department secret, away from the public, and he names the highest executives in the UNC Health system as supporting his work. This is different from what has been told to the UNC Board of Trustees last year when they investigated the situation. And it's highly concerning when the highest level of UNC Health, the system-wide largest public health system in North Carolina, is communicating that they want to keep things secret from the public to avoid the pushback that they've already received, because quite clearly what they are doing is wrong. It is unethical. People don't want it. The UNC trustees don't want it. The UNC Board of Governors don't want it, but they're going to go ahead and do it anyway, secretly. This is the same pattern, Sloan, that we saw when we uncovered the CRT in preschool from Frank Porter Graham and those emails where they said they were going to take down the websites regarding CRT in preschool, but they might keep them for use later, that they were going to rearrange words to keep it secret from the public who might have objections. It is the same exact strategy, and we're seeing it in medicine, and this is even more dangerous.
Yeah. Yeah, I mean, it's a full system now that we are having a hard time getting away with. Last week, we talked about the Silicon Valley Bank. I mean, they were prioritizing singing and videos and all kinds of woke bull crap. And so, you know, and now we see that when you take your hands off the wheel, whether it's in healthcare or finance or whatever it is, and when you are prioritizing the wrong thing, you're going to have crashes of epic proportions. It's not just banks that crash, it's the healthcare system. I am extremely enraged that Republicans in the General Assembly have done nothing but pump billions over the last year, billions into these systems. Look, in 2010, Republicans won the majority here in North Carolina for opposing Obamacare. Obamacare is more like it, right?
Yeah.
And so healthcare policy actually carried Republicans into the victory. Most people don't, either they've forgotten that, or they don't even know it. And so healthcare policy is how we should lead. Now, just yesterday, we saw the House pass, again, Medicaid expansion, which will reward this insanity at UNC, ECU, and other places. And so, you know, if we govern like this, we're going to get more of this. Look, John Hardister, who is running for the labor secretary in North Carolina, he's been over universities for quite a while now, at least since, you know, last legislative season and now this one. I haven't heard him raise any issues about this DEI. I haven't heard him raise a peep really about all the stuff with the, you know, gain of function research and journalists now struggling to get those documents. So there's a lot of folks that want us to elect them to higher office. And see, they're not stepping up to do this as you would see Ron DeSantis doing it, or our wonderful Congressman Dan Bishop doing it.
Dan Bishop has been excellent. Yeah, no, it's very frustrating. And I attended a UNC Board of Trustees meeting. And what was interesting, and they were going over the UNC budget, some members of the Board of Trustees I thought, did a very good job in trying to say, look, we need more information before we approve this multi-billion-dollar budget. We aren't doing our jobs if we don't have some more details regarding this. I don't feel comfortable voting for this right now. While a few other trustees who would say, well, we shouldn't just not approve the budget. We need to trust our leadership and just vote for these billions of dollars. And I was really stunned at that, because the disconnection that some of these UNC trustees, some of them, not all of them, but some of them have shown with regards to what's going on at UNC Health. You can't trust the leadership. We have that proof now from the journalistic work of Jonathan Saylor, who revealed these emails that say they're basically lying. They want to keep this information hidden.
Well, and from you, you're selling yourself a little short. I mean, you have, Nancy has driven UNC Health into holes, I think 3 times in the last couple of years, to my count.
Right. And my working hypothesis has always been that the leadership knows about this and they have no intention of stopping it. They might give lip service to the public or to the governing boards that say, oh, we're working on it internally, or it's all exaggeration, it's not real. But my working hypothesis was that's just lip service. They are encouraging it. And that's what these emails document from the highest levels, the highest people at UNC, the chairman of the School of Medicine, the vice chair. These people are complicit in lying to the public about their intentions. And if you look at this task force report from the Allied Health Sciences, which is the most devastating resources on the UNC website. I mean, it's obvious. You just go to their website and they're the ones that have the, for example, the list of white supremacy characteristics that includes perfectionism and objectivity, everything you'd want in a doctor, right? Well, that's being a white supremacist, because that makes sense. This task force document that they tried to hide from the public that is now uncovered is the most grotesque thing I've ever read. And it's all forcing physicians and trainees, physicians, like people with already years of experience, and trainees in the health, the Allied Health Sciences, which is like PT and OT, into these sessions where they have to not just learn the ideology,
struggle sessions.
Yeah, exactly. And religion of DEI, but support it and publicly state their support for it, publicly make promises about activism and various things like climate change and political movements that have nothing to do with the practice of medicine directly. There isn't time for this. There isn't money for this. This is ridiculous, and it hurts the people of North Carolina. And now the people of North Carolina can't even trust their leadership in the UNC Health community. It is absolutely disturbing. I am shocked as a physician. I am saddened that my hypotheses have now been proven true, that, I was right that this stuff was being driven from the top levels. I am thankful for the work that Mr. Saylor has done to expose this. And I've been writing about it in American Thinker and trying to get people to pay attention. It's terrible that it's in our schools. It's ridiculous that K through 12 kids have to go through these struggle sessions, have to be indoctrinated. But to have your physicians, the people who are taking care of your kids, the people who you're supposed to trust, the people who are supposed to be open-minded and objective, now being compelled to be the opposite because some PhD happens to believe in this, along with some activist doctors around him. This is medical malpractice. It is disgusting. It needs to be called out and it needs to be stopped.
Yeah, absolutely. I mean, there's a guy that works up at UNC. He's a lobbyist for the child psychiatry program by the name of Nelson Dollar. This guy, Nelson Dollar, until recently was working in Speaker Tim Moore's office. So Speaker, in case you don't know, Tim Moore is the Speaker of the House, Republican. And so, a lot of the top legislators here in North Carolina have tentacles into UNC, and yet nothing's being done. Maybe that's the reason, right? Is that there's some sort of symbiotic relationship between the two, when UNC in particular is engaged in the most mendacious gaslighting I think I've ever seen, whether it's the scandal that was, I think, 8 years ago, where football players were not even required to go to class and they got extra credit. the anti-Semitism that was a scandal that was there 5 years ago, which I covered, to gain a function to this. And so, there's got to be a grown-up in the room that's going to say, damn it, enough. We're sending our kids here. We're paying for this. How much is enough?
I was trying to tell them that they can't just trust that this one single policy is going to fix things, that this is so much deeper than that. And they really don't realize it, and they need to hear about it. And, I've been working with some amazing people on the side who are trying to bring more attention to it. But I agree. I think these legislators, I think the people in some of the elitist positions, like the Board of Governors, Board of Trustees, are not in the weeds, so to speak, and are just quote unquote trusting the leadership, while the leadership is emailing each other saying, hey, let's keep this stuff a secret. It is a scandal. It is disgusting. It needs to be national news beyond just North Carolina. And the North Carolina public needs to ask some very serious questions of their medical system and of the legislators who are overseeing it.
Yeah. I think now, as I recall, our Lieutenant Governor, Mark Robinson, either he was going to do something or is doing something on this. Do you know anything about that? Have you heard and kept up with that?
Yes, he is, I think, planning. There are some legislative ideas in the legislature now while they're in session that are due to come out, that are being worked on. And I think he is involved in it. And so hopefully we'll see that soon. There are people in the legislature who are aware that there needs to be more oversight of some of these rogue activists in our medical system who are using it for their own personal political platform, so to speak, or religious platform, however you want to define woke, using and abusing physicians for their own insidious purposes. So hopefully we'll see that coming up in the next few weeks. But there are people in the legislature who are working with some very strong, talented minds to try to stop this in UNC medicine.
Great. And I really hope this has bipartisan support, because practicing racism is something that North Carolina has done in the past, particularly with eugenics. I believe we were the last state to outlaw eugenics, and that, all started, it kind of reminds me of this, chemical castration mutilation. It all started as something that, oh, wow, we're going to do this for the people's good. Certain people need to have this done. And back in the day, it was the mentally infirm is what they called it. They were going to take care of these folks, right? And then it became a tool to make sure that, Black people and others deemed inappropriate by, white supremacists were not able to procreate, which is, a moral stain on this state in particular. So, you know what I mean? I mean, so DEI becomes, we always know this, CRT becomes racism, right? The very thing that it's supposed to stop, it's actually perpetuating. And now when you mix that with medicine, the Holocaust started with doctors and nurses. And that's why this means so much to me, is eradicating this out from the medical system, most definitely. And then going to places it's already being performed. And that would be at ECU, which we have hard targeted. That would be at UNC, where they're cutting the genitals off of healthy children because, gosh darn it, if we didn't do it, it would cause suicide. Well, that was done with Alan Turing. That was done by the Brits in the 40s to punish him for being gay. They gave him a choice. You can either choose to be incarcerated, I believe it was for a lifetime, or you can choose chemical castration. And they gave him this wonderful code breaker. They gave him medication that is just like Lupron, doing the very same thing to our children. And to no surprise, he committed suicide. And, it's only been recently that the Queen, not only exonerated him from any wrongdoing, which was a long time coming, but apologized on behalf of the Brits for what they did to him. And why was this a human rights abuse on a massive scale? And liberal writers were writing about this in 2010 and 2011 when, UK Prime Minister Gordon Brown pardoned Alan Turing. They're writing about what a horrible thing it was to do to gay people. back then. But now it is enlightened treatment for kids who are questioning their gender. This is dangerous stuff, guys. Very dangerous stuff. The time to speak out about it was years ago. We have a lot of catching up to do.
It's very dangerous.